Jay Navarro, and I'm here to share some information and tips about the Affordable Care Act, also known as Obamacare. The Affordable Care Act offers affordable health coverage options even if an individual has pre-existing health conditions. The Affordable Care Act includes 10 essential health benefits: ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, including behavioral health treatment, prescription drugs, rehabilitative and habilitative service and devices, laboratory services, preventative and wellness services and chronic disease management, pediatric services, including oral and vision care. Marketplace enrollment happens every year, typically from November 1st to December 15th. Outside of open enrollment, Marketplace offers a special enrollment period for qualifying life events. You can access the ACA health insurance plans through the Marketplace on healthcare.gov. And depending on the state you live in, different names and laws may apply. Here in the state of New Hampshire, residents have access to the federally facilitated exchange via a state partnership with the New Hampshire Department of Insurance toward meeting the needs of state residents. You can visit our website for resources and information. Beginning in 2019, consumers in New Hampshire may be able to go without coverage and not face a fine. However, you may want to check in with the State Department of Insurance for future updates. Some of the life changes that can qualify you for a special enrollment period are changes in household and residence in the past 60 days, loss of health insurance. It is important to note that you may qualify for a special enrollment period if you or anyone in your household lost qualifying coverage in the past 60 days or expects to lose coverage in the next 60 days. In most cases, you may need to provide documentation proving that you have lost coverage within the last 60 days. For a more detailed overview, please go to healthcare.gov or make an appointment with a certified application counselor. You will need your personal email address in order to confirm your account or your login information in the event that you've already created an account on healthcare.gov. And if you are employed, you will need to have a copy of the employer coverage tool filled out by your employer or the human resources personnel in order to insert that information on your application. You should review the Marketplace checklist for any required additional information about you or your household members. The federal poverty guidelines are used to determine eligibility for certain federal programs, whether you apply on the Marketplace or for Medicaid. Your threshold is based on your household income and household size. This chart shows the federal poverty guidelines for 2018 based on the income and household size and is used to determine if people are eligible. Please refer to the resources section to see the current federal poverty guidelines. Find the number of members within your household to determine eligibility. Next, we will need to determine your total combined gross income. Gross income is the amount before taxes are removed from your paycheck. The numbers in red indicate weekly amounts, and the numbers in black are the annual amount. If you are self-employed, you may apply net income. You may need to consult with a public accountant for amount accuracy, which is the amount that would result in adjusted gross income. It is important to keep in mind that you should provide accurate information, and if changes in your household income should occur, that you edit and update your application accordingly, which in most cases would be within 10 business days. Find the role with your household size and see which income level most matches closely to your income without going over. Once you figure out your total, we will look at the percentile at the top of the chart that your household falls under. If you are within the green portion indicating up to 133%, there is a second step that we will need to look at to determine Medicaid eligibility. You will need to identify your citizenship status. If you are not a U.S. citizen, you must meet one of the qualifying factors outlined here. Medicaid can be applied for year-round. If you meet the criteria, you can go ahead and set up an account on newhampshireeasy.gov. If you receive a denial letter from Medicaid, review carefully. You may want to set up an appointment with a certified application counselor and determine if you need to enter into the marketplace. Watch our Medicaid video for more information about the application process. If you fall within the blue portion of the Federal Poverty Guidelines chart, then your household size and income do not qualify for Medicaid and you will need to apply through the marketplace. Or if you did not meet criteria for Medicaid due to income or immigration status. If you are in need of financial assistance through the marketplace, you will need to make sure of the following: that you answer yes when asked if you need financial assistance on your marketplace application, that you do not qualify for Medicaid, that your income does not exceed the 400th percentile of the Federal Poverty Guidelines, that you are not able to gain coverage through an employer. The income information you entered is being projected for the upcoming year. Be sure to set a reminder for any updates and edits come January. That you file taxes at the end of the year and that the income information matches on your application and on your tax filing. And if married, that you and your spouse file taxes jointly. Advanced Premium Tax Credit, APTC, a tax credit you can take in advance to lower your monthly health insurance payment known as premium for qualifying individuals up to 400th percentile. Cost sharing reduction, to reduce out-of-pocket spending on silver plans for qualifying individuals up to the 250th percentile. Upon completion of your application, you will be able to review the eligibility determination. This will guide you toward the next step as to your health coverage options and indicate if you are qualified for a subsidy toward your monthly premium. It is vital that you carefully read this document to see if you need to submit copies of required information by a certain date to ensure health coverage. You have the option of uploading that information into your account or submitting via postal mail. And if you send it through the mail, you may want to send it by certified or registered mail as a means of tracking. And do not forget to include a copy of the bar scan page on your eligibility determination. Here's the checklist to keep in mind. Make copies of your application to keep on file. Always make copies of proofs. Do not give originals. Protect your information. Do not email any personal information. If your document is in color, copy it in color and scan it in color, then upload. If you are able to print screen, then save on a Word document and print a copy to staple it together with the document requesting proof. Keep a folder or large manila envelope with all information for easy access. Keep track of calls to the marketplace, Medicaid, or health insurance on your envelope to include date, time, length of call, reason, and outcome. If you qualify for a marketplace health plan, you will be able to select from the different options available once you review your eligibility determination. You will then be able to compare your health coverage options side by side and by metal tiers, bronze, silver, gold, and possibly Platinum. This is where you will see the monthly premium amounts and coverage details. For additional information about premiums and marketplace tiers, please check out the resources on our website. Key factors that you should review prior to making your health insurance coverage selection are the following: hospital network, PCP network, and prescription. Dental insurance is offered separately, and you will be able to make that choice once you finish selecting your medical insurance. You have the option of choosing a plan. It is not mandatory for adults. Upon submitting your application by December 15th, your coverage should be set to start for January 1st. Keep in mind that you must have completed your application and enrolled in a plan. The fastest way to submit this payment is online upon enrolling in the health plan. Should you choose another payment, you should review terms carefully and submit payment by the date required in order to guarantee enrollment. Review your eligibility determination and submit any and all required documentation as soon as possible to avoid delays. Once you receive your health insurance card, review your personal information for accuracy and report any changes if need be. Call your insurance member services number on the back of your card to ask about preferred labs and testing that your health insurance company has contracted with. Don't forget to inform them of your PCP selection in order to start the process of managing your health coverage. Here's to a healthier you.